Do your hands feel numb while sleeping, or do you feel weakness in your hands? You are watching the third part of the first episode of Physical Examination of Sugar. As you know that sugar can cause 5 types of hand diseases. We have mentioned chiroarthropathy and Dupuytren in detail in the first 2 parts. Carpal tunnel syndrome, flexor tenosynovitis and muscle wasting will be mentioned soon. In this part of the physical examination, we will learn about the complete details of carpal tunnel syndrome. Before checking the details, quickly subscribe the channel and like the video. In this video, we will know what carpal tunnel syndrome is, how carpal tunnel syndrome occurs, what are the symptoms of carpal tunnel syndrome, how carpal tunnel syndrome can be diagnosed, and how carpal tunnel syndrome is treated. This disease is caused by the inflammation of the median nerve between the bones in the wrist. To understand carpal tunnel syndrome, you must first know about carpal bones and carpal tunnel. The bones in the wrist that help the movement of the wrist are called carpal bones. There is a space between the carpal bones from where the veins and nerves pass, which is called the tunnel, and the space between the carpal bones is called the carpal tunnel. If you have numbness in your hands, the median nerve plays an important role in controlling arm and hand movements through the brain and spinal cord. The median nerve passes through the tunnel through the wrist to enter into the palm, from where it joins the thumb, to the index finger, and also to the middle finger. What are the causes of carpal tunnel syndrome? It is caused by blood sugar, thyroid disorder, fluid retention, high blood pressure, joint inflammation, and bone fracture. What are its symptoms? A feeling of weakness in the hands while holding something, a feeling of pain in one or both hands, a tingling sensation in the fingertips, swelling due to pain in the fingers, thumb, forefinger, and middle finger, include burning or tingling sensations, and numbness in the hands while sleeping at night. Now we will see how carpal tunnel syndrome is diagnosed. The recommended procedure for making a diagnosis is to first take your medical history. Medical history includes previous history of your joints and bones, blood sugar level, any injury, etc., and any family member having diabetes or carpal tunnel syndrome. After the medical history, your physical examination is done. First of all, you are asked to check the strength of the hands, then the inflammation in the wrists, shoulders, and neck is checked, where the sensation of pain is felt by pressure. If any symptoms appear after the physical examination, a specific test is done for it, which is called a nerve conduct study. In this test, the stimulator is placed over the median nerve and a current is given to the median nerve from the electrode and anode. After giving the current, the active electrode, which shows the near movement, and the referral electrode, which shows the movement away from the active electrode. To treat it, it is important to know your age, your health and medical history, how bad your wrist is, and whether the medicine you will be given is appropriate for your health. How bad is your disease, and what is your opinion about your own disease? For its treatment, an effective method called splinting is done, in which a bandage is wrapped around the wrist so that no movement is possible in the wrist, and due to lack of movement, the pressure on the median nerve also decreases. Another effective method is anti-inflammatory drugs. The most commonly used method of anti-inflammatory drugs is direct injection at the site of carpal tunnel syndrome. The third method is surgery. It is mostly done in people who have a lot of numbness in their hands. The fourth method is exercise, in which neither you will have to take medicine nor expensive surgery, you can do it at home. We show you how to do the exercise, which includes pressing with the hands, bending the wrist down, pressing the ball, moving the hand right and left, bending the wrist down, turning the wrist upside down, moving the hands, bending the fingers, holding the ball and moving the wrist up and down, holding the ball from the wrist and spinning straight on the table. We will be posting our next detailed video on flexor tenosynovitis soon. You can express your opinion by commenting. If you haven't subscribed to our channel yet, then quickly subscribe, like and share the channel.